As a pediatric radiologist, I've always appreciated the opportunity to share some of the aspects of pediatric radiology and hopefully teach other people a little bit about practical aspects of pediatric radiology. But I also appreciate coming to a meeting that's very focused on CT, and then I can hear about new things, cutting-edge things that are happening in adult CT, because oftentimes these things start in the adult world and then trickle down to the pediatric world. Although occasionally it's the other way around.
Well, firstly, let me say that this is always a terrific meeting because it really brings together the thought leaders and experts in every area of CT imaging. I clearly have a special interest in emergency and neuroradiology, and this happens to be a very exciting time for neuroimaging, especially because of all of the recent positive stroke trials that were published in the New England Journal of Medicine that show that intraarterial stroke therapy is effective for stroke, and that's a very big deal because it's really the most important treatment advance since the FDA approved intravenous thrombolytic drugs in 1996. Other topics that are really of interest in this meeting are the increasing use of dual energy CT, especially in an emergency setting for problem solving, but not only for problem solving, also for routine bread and butter type of use. It can let you distinguish hemorrhage from calcification in brain scans. It could let you distinguish hemorrhage from iodine if contrast has already been given, and that's an exciting development. There have also been developments in workflow. One of the things that is becoming increasingly important to radiology in this era of value-based medicine is being able to have metrics that show we are adding value and adding quality to patient management, that the type of things we look at in images can actually change management. It impacts on things like length of stay, and it really has a lot of downstream effects in terms of really a patient's whole experience, both in the emergency room and when admitted as an inpatient. And those are the type of really hot off the press issues that get discussed at this meeting. So it's always up to date, and it's always highlighting the newest stuff out there because of the level of the faculty and the speakers.
I think the most exciting thing for me is the opportunity to meet such great minds and the exchange of ideas to see what everybody else is doing across the world, the innovation, the pioneering of what's happening with computer tomography. To me, that sharing of the ideas, the discussion of those ideas, I think helps stimulate ourselves to go back home and try some of the things that we've learned at this conference.
Well, overall, the symposium is fabulous. I do both pediatric radiology and adult radiology. In this particular context, I was in the pediatric radiology session. So in that session, it gave me the opportunity to see what my colleagues are doing, the possibility for new ideas for research, and to interact with them about their ongoing work and perhaps future collaborations. The symposium overall, my interest is in oncology. I actually run a core lab where I do all the tumor response assessments, so I was intrigued to hear some of the presentations on measurements for tumor response and assessment, and to me that was one of the exciting areas. I also do thoracic imaging, so the sessions on thoracic imaging, the lung cancer screening, was something I was interested in. Also, some of the potential for new measurements, volume measurements, what their role might be, some of the functional imaging was also exciting at this meeting. The people who spoke are really experts in the field, and they bring a new dimension. It's not just delivering the same old talks that we hear often at meetings, and they do have a role, but it's in part there's some exciting research going on here.
I think the symposium's content and how the information was distributed, whether it was the debates or different presentations, really highlighted where CT is and where CT is going. And I think it was very exciting to see all of the advances in CT, all of the opportunities, and all of the changes that we are all experiencing.
ISCT is a really interesting meeting for me every year. I liked coming to hear new innovations in CT, IT, and in imaging in general. The imaging conversation is not limited to one modality, but really brings together a group of people to show how innovative we can be with CT and how innovative we can be in limiting dose to our patients.
The ISCT Symposium is a very engaging group of people. We discuss cutting edge, really innovative, unique things that are happening at the point of care in departments all across the country. CT being such a ubiquitous modality across the country and such a valuable piece of patient care across the country and the world. It's nice to bring together experts from many different sites across the United States and internationally to discuss best practices, to discuss the implications of what it has provided to patient care local to them. And it's a fun meeting to be at. It's very much a group of people who are unique in the way that they think, unique in the way that they roll out process improvement, unique in the way that they implement operational change to support computed tomography and support medical imaging more broadly for the care of the patients that they provide.
I think the most fascinating part about the ISCT is, like the I implies, it's a truly international meeting. Last night I had an excellent dinner with individuals from the Netherlands, from Germany, and from Italy, and this allows for a interesting exchange of ideas on the state of the art in CT and other aspects of radiology, and being able to hear from people across the globe really brings you up to date to the latest and greatest with this technology.